Hello, welcome to Wellness Wednesday with Maple Tree Cancer Alliance. Whether you're newly diagnosed, undergoing treatment, or in recovery, this conversation is for you. I'm Ariel, an exercise oncology educator, and today's conversation is on hygiene practices during chemotherapy. And following our conversation, stick around for some gentle movement. The information in this video is for educational purposes only, and it is important to consult with your medical care team for more in-depth guidance and advice. Let's get started. Why should you practice good hygiene? Maintaining personal cleanliness helps preserve a sense of dignity and confidence. It also contributes to an improved mental and emotional well-being and helps improve your comfortability with yourself and how you interact with others. And treatment can weaken the immune system, making the body more susceptible to infection. So maintaining and practicing good hygiene can reduce the risk of any infections. When going through cancer treatment, you may face some unique challenges. These challenges are skin sensitivities, hair loss, and fatigue and limited mobility. If you are experiencing some skin sensitivities, use fragrance-free hypoallergenic products and avoid those harsh chemicals to help prevent any skin discomfort. Hair loss, which is a common side effect of chemotherapy, using gentle shampoos, soft brushes, and head coverings to help maintain comfort and cleanliness. And feeling fatigued and having limited mobility can make personal hygiene more challenging. So using assisted devices that are out there, such as a shower chair, no-touch soap dispensers, non-slip mats, handled sponges, or a raised toilet seat can help you with some of these challenges, along with seeking support from a caregiver or friend. Let's talk about oral health. Proper hygiene is crucial during chemotherapy. This is because the body cannot fight off infections as well as it used to. Brushing your teeth, your gums, and your tongue twice a day using fluoride toothpaste can aid in keeping you healthy. It's recommended to change out your toothbrush monthly. And it's also recommended to rinse your mouth with a saltwater solution to help clear bacteria. And staying hydrated can help you fight dry mouth. Showering and bathing is super important while going through chemotherapy. You want to make sure that you're bathing daily with warm water, avoid soaking in spas or hot tubs, keep the central lines, ports, and catheter areas clean and dry. Use a shower chair to avoid slipping and to conserve your energy, and make sure to not share bath towels with other family members. Hand hygiene is one of the most important things you can do to prevent infections. Washing your hands before and after preparing a meal, after touching raw meat or fish, after using the bathroom, or touching bodily fluids such as urine, stool, mucus, or blood. I recommend if you touch anything that somebody else has touched, just be cautious and wash your hands. Two ways of doing hand hygiene: you can wash your hands with soap and hot water, or use an alcohol-based hand sanitizer. My recommendation is to keep a small hand sanitizer or wipes with you wherever you go, so you always have the option to keep those hands clean. When going through chemotherapy, it's important to take extra precaution and to reduce the risk of any cuts, scrapes, injuries, and infections. Here are a few tips that might help you moving forward. When shaving, use an electric razor instead of a blade. Wear gloves when washing dishes, gardening, using knives, and cleaning a wound, whether that be on yourself or someone else. Use caution when exercising or walking to avoid falling and scraping the skin. And do not cut, tear, or bite your cuticles. Thank you for being a part of our conversation today on good hygiene during chemotherapy. I hope the information we've covered has brought you some clarity and comfort. Your health and well-being are what matters most, so please take care of yourself, stay informed, and remember that hope is always present. Now let's transition into some gentle movement to further support your journey.
Hi guys, I'm Morgan, your exercise oncology instructor for Maple Tree Cancer Alliance. Welcome to week 11 of our low intensity strength training program. This week we will be focusing on our lower body. We will need a sturdy chair, a place to lay down, and an object like a thick book to help elevate your heels. As always, safety is our top priority, so remember to listen to your body and perform the exercises within your pain-free range of motion. All right, let's get started. All right, guys, we're going to get started with our week 11 warm-up, and we will start with some standing marches. We're going to do 20, and what that's going to look like is we're just going to march in place just to get our bodies moving and get our heart pumping a little bit. All right, we're going to do 20. So 1, 2, 3, 4 is how we're going to count, and let's go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. All right, and then we are going to bend down towards our toes, and I'm going to turn sideways so that you guys can see, and we're just going to bend our knees and go as low as we can, and then keep reaching towards those toes. And so we're going to do this movement 10 times, and I call it a bootstrapper. Some of you call it a squat and stretch, but we have 10 of them. And so if you're able to grab those toes, I want you to grab them. You might have to move your feet out so you have a little extra room for your squat, but we are going to squat down, relax, and then bring it back up, stretching out those hamstrings. And that's 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. And we are going to stand all the way up. And we're just going to reach towards our toes, but we're going to focus on stretching out our lower back. So we're going to round that back, reach towards those toes with straight knees until we feel that stretch. And if you're able to touch those toes, that's great. If you're not, then I just want you to stretch as far as you can. And then we're going to roll back up with our spine. We're going to do that one more time. Rounding that back, reaching towards those toes, and then rolling up with our spine. And then we are going to move on to a calf stretch. So I want you guys to be in a nice lunge, trying to keep your heels on the floor, leaning forwards, stretching out that calf, and we're going to hold this for 20 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. And let's switch our feet. So again, in that nice lunge, pushing that heel towards the floor. And 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. All right, and our last warm-up exercise and stretch is going to be some hip openers. So we are going to spread our feet, and we're going to turn one foot out so that our knee and foot are facing sideways, and we're just going to lean into that foot. And you should feel a nice stretch in the front of both hips. And then we're going to push back. And then we're going to lean again with that toe over your knee. And push back. And one more time. And then we're going to switch. So keeping your feet in the place that they are, but we're going to switch that other foot. So the foot on the opposite side is going to be facing out along with that knee. And then we're going to be pushing that knee over our toe, getting that nice stretch in our hips. And then push back. And we have two more. And push back. And then last one. And let's turn those feet back in. And if you have your book now is the time to grab it, because when we start our workout, we are going to be using that to start. All right, so I'm going to use my yoga mat, and I'm putting it behind my heels and standing on it with just my heels on top, and my toes are fully on the floor supporting my weight. And this is called a bicycle squat. So we are going to be squatting. Our stance is going to be a little bit more narrow than we normally do, but our feet should still be underneath our hips. And we're going to keep our chest upright, and we're just going to squat as low as we can and then come back up. And this should be more concentrated in the top muscles of those legs, and we have 10 of them. So make sure you have your book, that you're nice and stable, toes are on the floor, chest is up, and we're gonna do 10 bicycle squats. So 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. All right, and we're gonna step off our book or whatever we are standing on, and we're gonna spread our feet, and we are going to do a sumo squat. So these squats are more focused on the back of our legs and our glutes. So again, we want that chest nice and upright, and I want you to turn your toes out just a little bit so that your knees can go over your toes without caving in. All right, we have 10. And 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. All right, and now we're going to use our chair. So with our chair or an elevated object, we're going to do toe touches. So we're just raising that leg, touching our toes to the top, and standing nice and straight, keeping a nice tight core. All right, we have 10, so it's gonna be 5 on each side. And 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. All right, we're going to go back through all of our exercises 2 more times. And so we're starting over with our bicycle squats. So find your book or whatever you elevated your heels on. And we have our second set of 10. So again, we're keeping our shoulders back, chest up, and knees over toes. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. All right, stepping off of that object, spreading our feet out, toes out to the side. We have our 10 sumo squats. All right, chest up, and 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. All right, and moving over to your chair, we have our set of 10 of our toe taps. Hands on hips, chest straight up, lifting that leg. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. All right, we're gonna take a little quick breather. And then we have one more set going through our bicycle, sumo, and toe taps. One more breath. And standing on our book, chest up, and going as low as you can, 10 bicycle squats. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. All right, stepping off, nice wide stance, toes out to the side. Deep breath. And we have 10 sumo squats. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. All right, last set of toe taps. Hands on those hips. Take a nice deep breath. And 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. All right, great job. We have one more part of our workout. This is the part that involves laying down on the ground. So we are going to roll out our yoga mat. And we are going to be laying down on our back. What we are going to start with is some supine tabletop presses. And so what that's going to look like is we're going to lay on our back with our knees up, hands up, and we're just like a table. And then we're going to lower those elbows and then press up to the ceiling. And so we want that lower back pressing into the floor so that we have a nice stable spine. And we are going to start with a set of 10. So elbows down and press. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. All right, we can go ahead and relax. Our next movement is going to be some glute bridges. So when we do our glute bridge, we want to squeeze our butt up off the floor so that we aren't using our legs or our hips instead of those glutes. And so we're going to do a set of 10. And what I like to do is take a breath in on the way down, and then when I squeeze my butt and lift my hips, then I want you to breathe out. All right, and we are going to start our 10, squeezing our butt. And 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. All right, and then our last movement is going to be leg lifts. And so I'm going to turn so that you guys can see, but we're going to put our hands under our butt and lay flat, and we're just going to lift our leg up and down 10 times. So we should have a nice tight core, trying to push our lower back into the floor. And 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. All right, and we're gonna switch legs, and I just want you guys to lift your leg as high as you can. You don't have to go super high, just lifting it a good couple inches off the floor is enough. And 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. All right, so I am going to turn again, and we're going to start over. We are going to go through all 3 movements 2 more times. So we're going to start with that tabletop press. So our knees are up, hands are up, our back is being pushed into the floor, and we're bringing those elbows down and press. And ready? 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. All right, and then we're going to move on to our glute bridges and raising those hips with our butt. And exhale. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. All right, and we're going to go ahead and do our leg lift. So hands underneath our butt, legs laying flat out, and raising that leg. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. All right, and we're gonna switch. So opposite leg, and 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. All right, and one more time through. We are going to start with our tabletop. So knees up, hands up, and press. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. And lower those knees, hands down on the floor, lifting those hips for our glute bridge. And 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. All right, and last set of our leg lifts. Hands underneath our butt, legs straight out, and 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. And we're gonna switch. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. All right. Go ahead and sit up. Great job, guys, with the workout part, and now we're going to start our cool down. So I am going to stand up, and we're going to stand in our straddle, and we're just going to reach up to the ceiling, and then reach down to the floor. Just reach as far as you can. Take a nice breath, and then reach up to the ceiling, and down to the floor. A nice deep breath. All right, and we are going to stretch over to the side. So staying straight up, raising one arm down on our leg, and getting that nice side stretch and switch. And we're gonna go through that one more time, raising one arm overhead and then the other. All right, and we're gonna stay in this straddle. Just like our warm-up stretch, I want you to turn that foot out so we can do our hip openers and hands on our hips, and we're just gonna lean forwards and back and lean forwards and back, and one more time. All right, and then make sure that foot is facing forward, turning that other foot to the side, and we're gonna lean into that foot and push back, and lean into that foot and push back, and one more, and push back. All right, we are going to move on to our quad stretch. So if you need something to hold on to, you can use your chair or a wall. And so we're going to either grab our foot if we are able to and stand on one leg, either holding on to something or by our own balance and stretching out that quad. You can even go over to your chair, putting your foot on there and leaning back into that chair as we stretch out that quad. All right, and then we're going to do the other side. Stretching that quad. And again, you can do the same thing with the chair. And we are going to go into our last stretch, which is going to be our calf stretch. So nice lunge, leaning forwards, pressing that back heel to the floor, and switch. And we're going to do this 2 times through, so we got one more time, pressing that foot into the floor, and switch. And last one, pressing that heel to the floor, stretching out that calf, and done. All right, thank you for joining me on week 11. You guys did great, and I'll see you next week.